COVID-19 is one of the most significant public health challenges that we have faced in several generations. At times, it has forced us to make difficult choices and implement aggressive restrictions to limit the spread, prevent our health system from being overwhelmed, and protect those most at risk. The impact of COVID-19 and the impact of the restrictions that we have implemented are far-reaching. It will take many years for us to understand the full impact that this pandemic has had and is still having on our mental, physical, and emotional health. The report released yesterday showed the challenges that many Albertans who use opioids and other substances have faced, and the dire impact that this pandemic has had on their lives. During the first 6 months of 2020, 449 people died from apparent unintentional opioid poisoning. This is an average of 2.5 people per day. Tragically, 301 of these deaths occurred between April and June. That is a staggering number. My heart goes out to everyone who has lost someone they loved. It can't be ignored that deaths rose during the first few months of the pandemic, which we know caused challenges for many Albertans. This includes challenges in accessing the supports and services they depend on, and increases in isolation, stress, and anxiety. The impact goes beyond simply the number of lives that were lost. There were also more than 3,000 emergency and urgent care visits related to opioids and other drug use between April and June. These numbers are difficult and troubling to hear. We know that other jurisdictions are seeing similar trends as the far-reaching impacts of COVID-19 are felt across our society. Over the past several months, we have adjusted COVID prevention policies to try and make sure that individuals who use drugs can continue to access critical services across the spectrum from harm reduction to treatment and recovery. But I know there is more to do. The pandemic is still going to be with us for many months. I will continue to work to minimize the impact of COVID-19 prevention measures on access to services. If any changes are needed, we will make them. I also want to let anyone experiencing addiction, either personally or in a loved one, know that you are not alone and help is available. If you use drugs, please don't use alone. If you want help but don't know where to turn, there is a 24-hour phone number you can call to access support at 1-866-332-2322 or go to Alberta Health Services website, Help in Tough Times. The rise in deaths from opioid poisoning is a reminder that the ripple effects of COVID-19 are large and that we need to continue seeking a balance in our response. We must embrace two needs at once: the need to minimize the impact of COVID-19 and the need to minimize the impact that these restrictions have on the rest of our health. Our collective efforts to prevent a sharp rise in cases remain in place, with 158 new cases of COVID-19 identified yesterday out of more than 12,700 tests completed by the provincial lab. This gives us a provincial positivity rate of 1.02%. Currently, Alberta has 1,462 active cases. 58 people are currently in hospital, including 14 in intensive care. Turning to schools, as of today, AHS has confirmed that 13 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 97 schools with 163 active cases in total. This represents about 4% of schools in the province. There are 32 school outbreaks, 7 of which have had likely transmission within the school in at least one case, and 4 of which have 5 or more cases and are therefore listed in the Watch category on our website. I remind everyone that although 2 confirmed cases in a school may qualify as an outbreak, it is not a sign that a school is unsafe. In fact, we have looked at our data on school-aged cases over the past several months and have seen that the weekly number of cases in those aged 5 to 19 has been most impacted by community transmission trends. Our highest weekly number of cases in this age group to date was in April, at the time of our peak overall, when we had 216 cases in this age group in 1 week out of 2,257 people tested. School-aged cases have fluctuated with community transmission, but since school started on September 1st, we have actually seen a week-over-week decrease from 205 to 183 to 122 cases per week in school-aged children. This is despite a significant increase in testing, with over 11,000, 18,000, and 14,000 children tested in these 3 weeks respectively. Sadly, I must report that there has been one additional death from COVID-19. This was in a patient at Foothills Medical Center, and this was first reported yesterday by AHS. My condolences go out to this person's family members and friends, and to all those grieving a loved one from any cause. The outbreak at Foothills Medical Center is concerning, and AHS is working very hard to protect staff and patients and limit any spread. There are now 29 cases linked to this outbreak, including 17 patients. Sadly, there have been 3 deaths as well. AHS continues to conduct testing and isolating of anyone who has been exposed and has significant precautions in place to prevent further spread.